Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation and the proud pastor of Church Alive Community Church. And once again, we're here to bring you a holistic approach to the gospel, and that is to bring you information, resources, and services that will improve the lifestyle of the body of Christ, our friends and neighbors, and certainly our relatives. Well, we are back with Dr. Tommy O, and the question is, ask Dr. Tommy O. And we want to thank AllMed for making this program available to you, and I hope that you will receive it, and the information that you will get today will bring you to a good understanding about lower back pain, and that's what we're going to be talking. Welcome once again, Dr.
Hi.
Tommy O.
Thank you. Welcome. How are you today?
I can imagine your patients coming in to your office saying, Dr. Tommy O, everybody seems to be into that particular title. Would you like to say something about AllMed?
Yes. Well, right now, my patients are real receptive to the show that we're offering to our community, which is a volunteer, health-oriented educational show. AllMed itself is what we call a multi-specialty discipline group where we offer multiple disciplines within one facility. This particular facility we offer orthopedics, family medicine or primary care, which is myself. We also offer pain management, gynecology, podiatric medicine, physical therapy, as well as gastroenterology. And as we're growing, we're adding more specialists and subspecialists.
Actually, you're adding new facilities too. You have a new facility that's coming up on Bronx Boulevard, right there near 233rd Street. And then you have another one coming on up at 138th Street in the South Bronx. And we're going to hear more about the expanding services of AllMed. But Dr. Tommy O, and I'm going to ask you to talk to me right now about lower back pain. Ask Dr. Tommy O, okay? Now, many people have problems with their back, and they're not sure where it comes from. And some people aren't realizing, is this something that is rare? Or how common is it, lower back pain?
Low back pain is very common. It's pretty significant. It can contribute or be attributed to approximately 5% of all primary care office visits. So that's approximately 5%. That's pretty significant.
A lot of this is work related too, isn't it?
Yes. Low back pain is the #1 cause for disability for the working class individual.
But still, you can have a problem with lower back pain domestically, just right in your home. Am I correct?
That's correct.
Now, what are some of the common causes of the disability of young adults?
Okay. Well, let's just define low back pain. Low back pain could be caused from a variety of pathology, from something as simple as urinary tract infection to a trauma like a motor vehicle accident or being hurt on the job, which is what we call a workers' compensation injury. The range varies. Something would be we need a thorough history and physical to make a decision on what the causes are, and that's something what we discuss with the patient. We sit down and they give a complete history and we're able to work it out.
Right. But this is pretty common among young adults, am I correct?
That's correct.
Right. We want to move along to find out how would one diagnose it, you know, because sometimes we think that lower back pain can give off different kinds of symptoms, and sometimes the symptoms are not relative to exactly what the problem is, you know, such as a gas or something like that, and somebody might think that's a problem. That's what they're getting. Tell us a little bit about the areas of how would you say diagnosis, pain diagnosis?
Right. Again, before we start, we must, with all my patients, take a thorough history and physical, and from there we sit down and discuss the pathology, or we develop what we call a differential diagnosis list. Within this, I might have to take lab testing, a urine analysis, because again, low back pain could be not a pain. It could be what we call deferred pain, meaning that you have pathology that's in a different part of your body, and the result or the pain is referred to your lower back, and it actually has nothing, not related to your lower back.
Well, I just use as an example. I came into you. You're my doctor, and I thank God for you. And I was having what I thought was gas pains in my back and area like that. And you didn't go directly to what my problem was, but you actually gave time to look at the whole person. You want to let me be the example for that situation, because I have a testimony of good results. Go right ahead.
Well, first, when you presented to me,
I came in
you presented to me. We sat down, we did history and physical, and you described the pain, and you said that it felt it was in your chest, and it could be more of gas. You weren't really sure exactly what it was, and you were concerned that it might be your heart. So first and foremost, if it's in the area of what we call the thoracic spine or the thorax, what we must do is rule out cardiac pathology. So the first thing I did was I sent you for an EKG just to make sure we don't have cardiac pathology. It turned out that the EKG came back negative, which is what we were hoping for. Then the next step is to do a thorough structural exam, and that's where I look at the musculoskeletal or the axial skeletal. And in doing so, I was able to reproduce the pain, which also indicated that it was not cardiac in nature, along with the EKG, which also made us at ease, or put us at ease. During this examination, I was able to palpate, meaning using my fingertips and feeling for specific areas, and then I was able to find out where the pain was. In your case, you had what we call somatic dysfunctions, or also rib dysfunctions, where you have slight changes in the musculoskeletal area, and that was giving a deferred pain because of this change in musculoskeletal biomechanics, just a little off.
Okay, and then I noticed you did a manipulator, laid me down, and I had a cracking sensation. Which that shocked me. I didn't even know where that came from. But tell me, what was that?
Okay. Well, after being that I'm an osteopathic physician, I'm trained in osteopathic manipulative medicine, and that is something that I hold dear to my heart. Besides the primary care aspect, I'm able to offer this as an adjunctive therapy. Basically, what it is it's hands-on approach, where you use your hands. You're able to palpate or touch or feel pathology in the musculoskeletal system, which is the muscles and the bones, and I'm able to treat pathology by using specifically designed techniques to realign the spine or the ribs or the bones themselves. Basically, I gave you a musculoskeletal exam, and we found out that you had what we call, as osteopaths call, somatic dysfunctions. You had the referred pain